I would like to ask Professor Petersen about that specific point. I mean, this is the first pandemic where mass testing is a pillar of the strategy. I would be interested in hearing your thoughts about that. And the second one is about the industry and the academia, this articulation that is bringing so many advantages and not exempt from some challenges as well. Professor Petersen.
Yeah, thank you very much, and thank you very much for inviting me for this interesting symposium. I think it's very important to realize that what we are experiencing right now is something new. I don't know if you lived through the 2009 influenza pandemic, but we didn't do a lot of testing there because it would have had no consequence. We didn't isolate people. We did not shut down parts of society. This is different because COVID is more serious with implications. And what we learned in the early months of the COVID pandemic was that the case definitions that were developed was not of very big use, especially because they included a certain geographical exposure, which turned out to be often weeks behind what was really happening. So perhaps, except for the Ebola outbreak in 2014-15, we are now in a situation, or we were last year, where quarantine was based on a positive test. And that's why the rapid expansion of the numbers of tests was so important, because testing is nothing but a tool to implement infection control like quarantine, case tracing, and so on. Now we are in a different situation, but of course it's very difficult for the governments to scale back on the testing. So testing in the scale that we have experienced over the past 2 years is something that is completely new to the international society, to all countries. And what we have learned here is that this is probably also what we will see in the next pandemic. Whatever it will be, there will be another one. But if it's serious enough, if we have to control a pandemic like we did with SARS-CoV-1 in 2003 with quarantine, case tracing and isolation, then we need testing, we need large-scale testing. So I think it's a very important lesson here that we have been able in a short time to build up the infrastructure to do large-scale testing, and without a strong public-private partnership, that would not have been possible. To your questions about academia, I come from a university, and I must say that all the new ideas comes from academia. What I also have to admit is that we are not very good at commercializing it. So maybe we have some very good ideas and we all think we are very brilliant, but rolling it out in a way that you can both deliver it and at the same time achieve a quality assurance and quality control is not our strong side. And there we need, again, a collaboration between academia and industry. Otherwise, the bright new ideas and technologies will not be able to make it to the majority of people and what you will call to the market. But therefore, a partnership is essential here.
Thank you very much, Professor Petersen. It is true that it's not always easy to transform new ideas and new discoveries into products, and then these products being used by the medical doctors and reaching the patients.
Hello? It is very difficult because we are in two different circles, and the contact between academic circles and industry are not that big. So it's very difficult sometimes. But I think it's somewhere where we need to focus. I think that you, my colleague here, mentioned sequencing, and developing mass sequencing has been a key technology here, because we need to know which of the variants do we have, and especially now in my country, Denmark, Omicron has rolled out from 1% to 96% in 6 weeks. We wouldn't have known that without large-scale sequencing. And where do the technology come from? From industry.
Indeed, indeed, indeed. Dr. Lee, you bring a very important and unique angle to this discussion and insights because of your role leading the most important company in Korea for testing, for mass testing. And you have been a champion working with the government and also incorporating innovation all at the same time and in the middle of a public health crisis. And all that resulting in a huge success in your country managing the COVID-19 epidemics. Can you give us more insights about this dialectic and these dynamics between these different sectors?
I would like to say the success story of COVID-19 response at the earliest stage. So in Korea, I think the biggest reason for Korea's success is that government, large commercial laboratories, and academic organizations conduct well in their respective areas and coordinate very well. First of all, I would like to say the role of government. The government informed people what institutions they can get COVID-19 tests and educated the safety manual repeatedly. And second, the role of a large commercial laboratory like GC Labs is very important. Our laboratory, commercial laboratory, private large-scale laboratory can conduct large-scale testing with their skilled staff and relatively abundant resources and space. So they could report the COVID-19 results within just 8 hours, and then made possible quarantine as quickly as possible. And in the case of GC Labs, we started performing COVID-19 tests since February 4th, 2020. Until now, the accumulated test number is approximately 15 million, and that counts for 25% of all COVID-19 testing number in Korea. And third, I think the role of academia is very, very important. As Dr. Petersen said that, the academic side in Korea, Korean Society of Laboratory Medicine verified the quality of COVID-19 test. They get emergency use authorization and established the appropriate and accurate pooling test manual. And in addition, the academic organization answered on problems arising from the testing process and interpretation of gradation results. So this well-organized cooperation of public, academia, and private laboratories was very well done in entire value chain of COVID-19 test. Yes, that's my answer.
I would be interested in about a specific point. I mean, we know that the private sector companies working with the government were able to report results within 8 hours only after the testing. That databases was administered by the government or by the companies themselves, or in a joint manner?
We report COVID-19 tests every day to KCDC, and they can know the real situation of COVID-19 situation. And we sent some COVID-19 samples to KCDC for sequencing, so they can know Omicron, Delta, like that. so they can establish very practical policy tailored to real situation of COVID-19 situation in Korea. That is very important cooperation with the government and large laboratories. Yeah.
Let's talk a little bit about funding, because it's always an element that is very much present and sometimes a barrier, sometimes an enabler. In the case of Korea, the payment for these tests was done by the health insurances or by the government itself or out of the pocket. What arrangement could you find for that?
Yeah, all COVID-19 testing fee is reimbursed from government health insurance, but the individual that would like to know their COVID-19 state, that is out of pocket.
Okay.
Yeah.
Excellent. Thank you very much, Dr. Lee.